It is shocking that this is still on the books at this point.
San Diego Gretchen Bergman says the state's decades-old laws regulating methadone, which is used to treat opioid withdrawal symptoms, are leading to more and more overdose deaths.
It's insane given the crisis that we're in. We're losing so many lives.
As founder of the nonprofit A New Path, or Parents for Addiction Treatment and Healing, she credits methadone for saving her own son's life.
I watched him go back to school on methadone, quit heroin, go back to school with methadone, and rebuild his life.
Methadone is the most effective treatment to help people get off of deadly drugs.
San Francisco Assemblymember Matt Haney is now leading the charge to make methadone more accessible.
We have the most restrictive policies in the country. We are way out of step where the rest of the world is on this.
While in many European countries, as well as Canada and Australia, methadone can be dispensed at pharmacies like other prescription medications, here in California, it's largely restricted to methadone clinics, where people seeking treatment for addiction have to line up every day to get their dosage.
Imagine having to go every single day to line up to get your medication. How can you hold a job? How can you support yourself? And that's what we're doing to these people when they're just trying to do the right thing and get off of deadly drugs.
Haney's proposed legislation would loosen those restrictions, allowing doctors to prescribe patients up to a 3-day supply of methadone, which would align California with newly revised federal guidelines.
Right now, we treat you like you're the problem, and we make it harder and harder on you to do anything, and the result is we're losing these people.
So why are California's policies surrounding methadone still so restrictive?
California is still way behind. Our laws related to methadone were put into place decades ago in the Vietnam War era.
Even though these regulations were well-intentioned, they've actually created much more barriers for people.
Dr. Leslie Soon, who teaches at UC San Francisco, says that California's stringent methadone policies were formed during the nation's so-called war on drugs, focusing on drug use as a criminal issue rather than a matter of public health.
More punishing people than trying to bring them in and help them with drug addiction. And so a lot of the laws are still echoing that sort of punitive response to this day.
This new effort to modernize California's rules, though, have also raised some concerns.
The devil's in the details, as they say.
Jason Kletter is president of California Opioid Maintenance Providers, representing 120 treatment facilities statewide serving 40,000 patients. He says while his group supports the intent of this proposal to increase access, he wants more safeguards in place to prevent misuse of the medication, pointing to data from a number of studies.
When methadone is prescribed for unsupervised use, it results in increases in overdose and death. And so we want to prevent that from happening.
I think that those concerns are valid.
Dr. Soon says that this proposed legislation requires any doctor prescribing take-home doses of methadone to meet strict guidelines already set by the Drug Enforcement Administration.
At the federal level, they've already implemented a lot of restrictions and a lot of safeguards in place.
And while methadone is highly effective, it's far from a cure. Many people who take methadone relapse depending on a number of factors. Still, supporters of this new bill are also hopeful that if access to methadone is expanded, the stigma surrounding this treatment option will diminish.
It's the most effective of all, but it's the most stigmatized.
Gretchen Bergman says this bill could help counter that negative perception of methadone, instead affirming it as a viable and extremely valuable treatment option.
Really what it is doing is saving people's lives, allowing them a chance to rebuild their lives.
And if ultimately passed by the State Assembly and Senate and signed by the governor, these new regulations could be in place starting next year. For more information on AB 2115, just go to CBS8.com, click on the online version of this story.